Did you know that every year, over 38 million people worldwide live with HIV, and yet, many of them don't even know they have it? This raises a crucial question: which HIV test can you trust, and when should you take it? The answer to this question is not as straightforward as it seems, and it's a mystery that will unravel throughout this video. But first, let's talk about the confusion surrounding HIV tests. With so many types of tests available, it's no wonder people are unsure about which one to choose. There are rapid tests, antibody tests, and PCR tests, each with its own strengths and weaknesses. But what do these tests actually do, and how do they work? Let's start with rapid tests. These tests are quick, convenient, and can give you results in just a few minutes. But, they're not always accurate, especially if you've been exposed to HIV recently. This is because rapid tests detect antibodies, which can take time to develop. Now, here's a common myth: many people believe that if they test negative for HIV, they're completely in the clear. But, that's not entirely true. If you've been exposed to HIV, it can take up to 3 months for antibodies to show up in your blood. This is known as the window period, and it's a critical time when you might not test positive, even if you have the virus. The correction to this myth is that antibody tests are not foolproof, and you need to wait for the right amount of time after exposure to get an accurate result. Let's break it down further. Antibody tests detect the antibodies that your body produces in response to the HIV virus. These tests are usually accurate after 3 months, but it's essential to wait for this period to pass before taking the test. On the other hand, PCR tests can detect the virus itself, rather than the antibodies. This makes them more accurate, especially in the early stages of infection. But, they're also more expensive and not as widely available. So, how do you choose the right test, and when should you take it? If you've been exposed to HIV, it's crucial to get tested as soon as possible. But, you need to wait for the right amount of time to pass before taking the test. If you take the test too early, you might get a false negative result, which can be misleading. On the other hand, if you wait too long, you might be putting yourself and others at risk. Now, let's compare the accuracy and reliability of these tests. Rapid tests are quick and easy, but they're not as accurate as antibody tests or PCR tests. Antibody tests are more accurate, but they require you to wait for 3 months after exposure. PCR tests are the most accurate, but they're also the most expensive. So, which test should you choose? The answer depends on your individual situation and the amount of time that has passed since exposure. When it comes to testing after exposure, timing is everything. If you've been exposed to HIV, you should get tested immediately, but you should also be prepared to take another test after 3 months. This will give you a more accurate result and help you determine whether you have the virus. But, what do the results actually mean? A positive result means that you have HIV, while a negative result means that you don't. But, if you've been exposed recently, a negative result might not be conclusive. Now, here's a surprising fact: many people are afraid to get tested for HIV because they're scared of the result. But, the truth is that testing is empowerment. By knowing your status, you can take control of your health and make informed decisions about your life. So, don't be afraid to get tested. It's a crucial step in taking care of yourself and those around you. In conclusion, HIV testing is not as simple as it seems. There are many types of tests, each with its own strengths and weaknesses. But, by understanding how these tests work and when to take them, you can take control of your health and make informed decisions about your life. So, what can you do right now? If you've been exposed to HIV or are at risk, get tested as soon as possible, and be prepared to take another test after 3 months. This will give you a more accurate result and help you determine whether you have the virus. By following these steps, you can take the first step towards empowerment and take control of your health. So, don't wait, get tested, know your status, and start living a healthier, happier life. And, if you want to stay up to date with the latest medical knowledge and tips, be sure to subscribe to Easy Medics Daily. We'll provide you with clear, life-saving information that will help you navigate the complex world of medicine. Thanks for watching, and we'll see you in the next video.